Hi, it's Trey Jones, and in this video, I'm going to explain Medicare Advantage. I'm going to give you the good, the bad, and everything in between, and we're going to jump right in here. To be eligible for a Medicare Advantage plan, you'll have to have and keep both Parts A and B of Medicare, which means you'll have to continue paying your monthly premium for Part B. The idea behind the Medicare Advantage program is to allow a private insurance company to provide you with your Medicare benefits instead of Medicare. So when you enroll in a Medicare Advantage plan, your relationship with Medicare will change. Specifically, Medicare no longer provides you directly with your Medicare benefits. Instead, Medicare will pay a set monthly dollar amount to your Medicare Advantage plan. In exchange for that payment from Medicare, your Advantage plan agrees to manage and provide you with your Medicare benefits, and this is why you'll sometimes hear these plans referred to as managed care plans. So you'll no longer use your red, white, and blue Medicare card. Instead, you're going to show your Medicare Advantage card. This means your Medicare Advantage plan now gets to tell you what your out-of-pocket requirements are. So they'll set your copay or your co-insurance amounts for different services like doctor visits or specialist visits or a hospital stay or different surgical procedures, etc. And because most Medicare Advantage plans will roll in coverage for your prescriptions, they'll set your copay amounts for your drugs as well. Another cost feature of these plans is the maximum out-of-pocket amount. And this is meant to act as a stop loss and limit your annual cost. Now, the amount Medicare pays a Medicare Advantage plan each month is not random. Medicare tracks its costs very closely, and so they know in every county how much an average Medicare beneficiary should cost them. This is called a benchmark number, and Medicare Advantage plans will bid against this benchmark number, and this is the process by which Medicare determines exactly how much they'll pay each Medicare Advantage plan per month. In most areas, it's over $1,000. So every month you're enrolled in your Medicare Advantage plan, that plan is being paid $1,000 or more by Medicare. So when you see the advertisement for a $0 monthly premium, you know that plan is not actually being paid nothing. In fact, the insurance companies that sell the Medicare Advantage plans are in business to do one thing and only one thing, which is make money, turn a profit. And because they're paid a fixed amount by Medicare, in order to be profitable, they have to control their costs. Now, there are several ways they're going to do this, but one of the ways that is most visible to you, the person actually enrolled in the plan, is by asking, or in some cases requiring, that you use doctors and specialists and hospitals, providers with whom they have a favorable cost agreement. And this is where you get your provider networks. And the two most common types of provider network are HMO and PPO. With an HMO plan or health maintenance organization plan, you'll usually be made to use doctors that are in the plan's network only, and in order to see any specialists, you're going to need a referral. With a PPO, or a preferred provider organization, as the name suggests, the plan will have a list of doctors and providers they'd prefer that you use. Now, you're allowed to go to providers not on that list, but you're usually going to have to pay more. Another consideration with Medicare Advantage is the enrollment period requirement. In order to change your Medicare Advantage plan or even disenroll from your plan, you must be in an enrollment period. Every year, you're allowed to change your Advantage plan during Medicare's annual enrollment period, which starts October 15th and runs through December 7th. And any changes you make during this window are going to take effect January 1st of the following year. Then, from January 1st through March 31st, you have the Medicare Advantage open enrollment or disenrollment period, during which, if you already have a Medicare Advantage plan, you're allowed to make one change. You can make a single change during this time frame. You can either change from your Medicare Advantage plan to another Medicare Advantage plan, or you can choose to disenroll from Medicare Advantage and go back to original Medicare. One of the caveats here is the doctors and providers that participate in the plan's network are not subject to the same enrollment period restrictions as you. Meaning, if mid-year your doctor decides to no longer take part in the plan's network or stops accepting the plan for any reason, your recourse is to either pay 100% of the cost when you go and see that doctor or just pick a new doctor. Now, especially during the enrollment period, you'll see a lot of commercials featuring extra benefits like dental or vision or gym memberships or whatever. Advantage plans are allowed to include benefits in their plans that are not covered by Medicare, but these benefits vary quite a bit from plan to plan and they change annually. So let's recap some of the benefits of the Advantage plans. First, they may limit your costs. So for example, a Medicare Advantage plan may limit your out-of-pocket at a doctor or a specialist to a copay. They'll also have a stated maximum out-of-pocket amount to act as a ceiling or a stop loss for your annual out-of-pocket. They'll usually roll in coverage for your drugs so you can have one plan that covers your medical and prescription costs. And then lastly, they are allowed to offer some benefits like dental or vision that are not offered by original Medicare. There are also some things that you need to be aware of before you enroll in one of these plans, like the annual out-of-pocket maximum number. You really need to know exactly what this number is, how high or low this number is before you enroll in the plan. These plans can and usually will change at least a little bit every year, so it's important that you remember to stay on top of these changes and how they might affect you. If you want to make a change to your Medicare Advantage plan, enroll in a different plan, or just disenroll from your Medicare Advantage plan and go back to Medicare, you have to be in a qualifying enrollment period to do that. I hope this video has helped you. If it has, please consider subscribing to the channel so you don't miss new videos as they're released. If you need help understanding Medicare or finding a Medicare product that's going to be the best fit for you, call my office. Our service is completely free to you. It's 1-800-520-5560. Thanks for watching. Have a great day. Bye-bye.